Tonight, we're going in depth with Oklahoma Insurance Commissioner Glen Mulready. Mulready reached out to say some big changes at the federal level could impact hundreds of thousands of Oklahomans' health insurance plans, especially when it comes to higher cost. I spoke with Mulready unedited about why many in our state will see some of these complications from changes. Commissioner, what did you notice about the Obamacare plans, and when did you notice a cut was coming?
So this has been on the table for a while. In fact, they've extended it a couple of years. They were originally scheduled to expire previously, and they just granted another year extension. And so this is a termination of these subsidies, or it's not the termination of the subsidies, it's a termination of the enhanced subsidies. And so it is scheduled to end on December 31st of 25. I guess my reason for putting out a press release, and I actually also sent a letter to the governor and the Speaker of the House and the Senate Pro Tem. It was, my words were waving the flag to make sure our other state leaders know this is coming and the impact that that could have on our state. But it will be, every state will be experiencing similar things. It's certainly not an Oklahoma thing. It's a national thing. As we move along here and seeing what's happening in the federal government and what they're trying to get to with cuts, I just believe personally, it's just my personal opinion, that I think it would be, I believe the renewal of that in some way is quite unlikely. Now, I'm hopeful that maybe they'll have some sort of compromise in there, that maybe they'll be reduced and extended another year and then maybe eliminate them in 2 years. But that's the landscape.
So these aren't Doge cuts. These were cuts that are already timed in with everything.
Yes, yeah. This has been on the table for a while. Literally for a couple of years to terminate them, and they've extended that 2 different times now. So,
are these cuts going to come in the middle of the current plan year, or are you just warning people for open enrollment to get your stuff to get together now? You have plenty of time to find other options.
Yeah, you have that right. It's not going to come. It's a 12/31 of 25 termination date that is scheduled. Our problem is, when I say our problem, I mean for Oklahoma, we utilize the federal marketplace. And so the deadlines for health plans to have rates in, like for us, I mean, that's like June 1st. So we're knocking on the door of that. And even to the health plans, it's difficult for them to price their product, not knowing if these, because that changes those actuarial assumptions. And I don't want to get in the insurance weeds too much here, but that's difficult on them. Now, states that are utilizing state-based exchange, they have a little bit extra time, but you need time to adapt and to evaluate rates. And we're knocking on that door. And so we'll see what happens. But I really am just trying to wave the flag to say, we're going to have. There'll be impact for individuals, right? Their premium is going to go up. Now, some folks may think that the average premium goes up $95. Well, that's not a lot, but you got to realize too, those folks that are receiving the enhanced subsidies are lower income folks. I mean, that's why they're receiving those, right? They're at a threshold of 400% or lower of the federal poverty level. That's what the subsidies are about. If I'm making a ton of money and I need individual health insurance, I won't qualify for a subsidy. It's folks that are lower income. So it's not inconsequential, those changes. So they'll see an increase. I think the other fear is, we'll see a number of folks go uninsured, because some of those folks, and unfortunately, it'll be those that are young and healthy who will say, I'm not going to pay that. And that changes the pool and the pricing of that. More people uninsured means more people showing up at the hospital too, and increasing our hospital system's uncompensated care. There's that impact. And then there's also the potential impact to our Medicaid program, which is partially funded by the state. It's a federal-state partnership.
So does this mean if everything falls into place, starting at the end of the year, if I'm on an Obamacare plan, I'm paying 100%?
No.
Okay.
No. Yes. Sorry. And that's why I try to use the terms the enhanced subsidies. So subsidies will still be available, but it'll revert back to the way they were pre-2021. I believe that was through the Inflation Reduction Act. And then the American Rescue Plan. Those were where the enhanced subsidies came in. So they're not totally going away. Don't want anyone to misinterpret that. The enhanced subsidies are what will go away.
Okay. So this was something that was put in place for COVID?
Okay. It was part of those programs. And really, trying to make sure people were insured. And it's been successful. I mean, not only in our state, but across the country, we've seen a substantial increase in enrollment during that time frame because of the enhanced subsidies.
What are there any state options? I mean, I know Sooner cares for kids, but is there any state option for me?
This is the option, right? Our marketplace, and we've got 6 options, 6 different health plans that are on there for individuals, which is nice because it wasn't that long ago, literally just a few years ago, where we only had one option. And so we have worked hard to try to bring more choices to Oklahoma. And so we have choices for folks. And now some of those are, only one of those is fully statewide. Others are limited to certain counties. And what happens is when a health plan comes to our state or starts doing business, they're typically going to start in the Tulsa or the Oklahoma City area, right, where the population is. And what we have seen is in the last couple of years, they then grow from there. They'll add on a number of counties as they expand and can get a network of physicians and hospitals on board and in their network. But that takes time and effort for them to get there. So that's typically what we see is the 2 metropolitan areas get the concentration of new plans, and then they grow out from that. So we have choices. You're correct. Sooner Cares is our Medicaid program, mainly for kids, pregnant moms too, and some other folks. But the only choices for folks on individual health insurance is through the marketplace that we're talking about.
Let's say I'm watching and I realize this impacts me. Do I call your office? What is the best way for me to prepare?
They certainly can call the office. What they might want to do, though, is also even just going on to the marketplace and seeing what else is out there. I mean, maybe they selected a plan that because they didn't have to pay a premium, because it was fully subsidized through the enhanced tax credits. But maybe taking a look at some of the other plans that are available and see is that available in my county. What's that network look like? Is it a hospital system that I will utilize so that if indeed this does come about and they want to move to maybe a less expensive plan, they'll know, who would fit them best.
Is it, and I've always had work-based health insurance. Is there a way I imagine it's not as easy as going to Walmart and picking bananas. Is there a system out there that I can buy affordable health insurance by myself without the subsidized plans or Obamacare?
Yeah. Don't get me wrong. The plans that are on the marketplace, that's the only place you can go and get the tax credits or get the subsidies of it. You can buy individual health plans off of that, but you're not going to be able to access subsidies off the marketplace.
Commissioner, is there anything else you'd like to mention? I appreciate your time today.
I don't think so, and you guys, I'm sure, will do it. But I would love to just make sure folks know that our phone number 1-800-522-0071, our website oid.ok.gov, and we've got a consumer assistance area there with a property and casualty division who's busy now with the different storms and disasters that we're dealing with here. But we also have a life and health division, so folks are there to answer their questions or if they have a problem with some health claims or anything like that.
Commissioner, thank you for your time. I appreciate it.
Okay, anytime. Thank you.
Thank you.